Assalamu alaikum. Today I'm going to present about repetitive nerve stimulation. This video prepared by Akmal Hafiz, Sayazwan Yusuf, and Zikri Arashi. Introduction. Repetitive nerve stimulation is used to diagnose neuromuscular junction (NMJ) disorders, the most common of which is myasthenia gravis. A decremental response, a smaller and smaller muscle response with each repetitive stimulus, is abnormal and indicates NMJ dysfunction. This can be further confirmed if the response normalizes after administration of edrophonium or neostigmine. Test of repetitive nerve stimulation. This test is carried out by stimulating any motor nerve repeatedly while recording electrodes are placed on innervated muscles. IT evaluates NMT's physiological condition by stimulating the nerve at different supramaximal stimulation rates during rest and after exercise. Low-rate stimulation, LRS, 1 to 5 Hz, and high-rate stimulation, hours, 10 to 50 Hz, are two types of nerve stimulation. The testing program is simple to use on distal muscles like those in the hand. This method uses a surface electrode from the ADQ muscle and stimulating electrodes at the ulnar nerve at the wrist to record the CMAP. According to the testing program, the nerve is stimulated at a frequency of 3 Hz. Some laboratories utilize a high rate of stimulation to rule out the possibility of cancer. A decrease of more than 10% at LRS and an increase of more than 100% at hours are both considered abnormal. The rate of stimulation, the muscles examined, the procedures used, and the activation tests used all influence the normal values for RNS tests. As a result, the usual value for the individual muscle and method must be consulted. The RNS test parameters are all useful in the diagnosis of NMT problems. Related disease/symptom related to repetitive stimulation test. What is myasthenia gravis? Myasthenia gravis is a chronic autoimmune, neuromuscular disease that causes weakness in the skeletal muscles that worsens after periods of activity and improves after periods of rest. These muscles are responsible for functions involving breathing and moving parts of the body, including the arms and legs. Myasthenia gravis is an autoimmune disease, which means the immune system, which normally protects the body from foreign organisms, mistakenly attacks itself. Myasthenia gravis is caused by an error in the transmission of nerve impulses to muscles. It occurs when normal communication between the nerve and muscle is interrupted at the neuromuscular junction, the place where nerve cells connect with the muscles they control. That neurons, or brain cells, use to communicate information. Normally when electrical signals or impulses travel down a motor nerve, the nerve endings release a neurotransmitter called acetylcholine that binds to sites called acetylcholine receptors on the muscle. The binding of acetylcholine to its receptor activates the muscle and causes a muscle contraction. In myasthenia gravis, antibodies, immune proteins produced by the body's immune system, block, alter, or destroy the receptors for acetylcholine at the neuromuscular junction, which prevents the muscle from contracting. This is most often caused by antibodies to the acetylcholine receptor itself, but antibodies to other proteins, such as MuSK, muscle-specific kinase, protein, also can impair transmission at the neuromuscular junction. What are the symptoms of myasthenia gravis? People with myasthenia gravis may experience the following symptoms. Weakness of the eye muscles, called ocular myasthenia. Drooping of one or both eyelids, ptosis. Blurred or double vision, diplopia. A change in facial expression. Difficulty swallowing. Shortness of breath. Impaired speech, dysarthria. Weakness in the arms, hands, fingers, legs, and neck. Sometimes the severe weakness of myasthenia gravis may cause respiratory failure, which requires immediate emergency medical care. Lambert-Eaton myasthenic syndrome, LEMS. Lambert-Eaton myasthenic syndrome, LEMS, is a rare autoimmune disorder of the neuromuscular junction. It is a miscommunication between the nerve cell and the muscles that lead to the gradual onset of muscle weakness. It starts in the proximal muscles of the legs or arms. What are the symptoms of LEMS? Aching muscles. Difficulty walking and climbing stairs. Difficulty lifting objects or raising the arms. Drooping eyelids, dry eyes and blurred vision. Swallowing problems. Dizziness upon standing. A dry mouth. Constipation. Erectile dysfunction. Strength that temporarily improves when exercising, only to reduce as exercise continues. What causes LEMS? LEMS is caused by the body's natural defenses, the immune system, mistakenly attacking and damaging the nerves. Normally, nerve signals travel down the nerves and stimulate the nerve endings to release a chemical called acetylcholine. This chemical then helps activate the muscles. Risks towards the patients that take the test. Nerve conduction investigations are extremely useful in diagnosing some illnesses of the body's nerves. The test is non-invasive, although the electrical shocks might be uncomfortable. Because the shocks are caused by a small quantity of electric current, they are not harmful to anyone. Patients who have a permanent pacemaker or other implanted stimulators, such as deep brain stimulators or spinal cord stimulators, must inform the examiner ahead of time. The study is not halted as a result of this, but particular safeguards are taken. Electrode attachment. This picture shows us the electrode attachment to the patient. That's all from us. Thanks you so much cause watch our video till end. Thanks you.